Thank you so much for joining us. I am a child, adolescent, and adult psychiatrist who is intensely into both fantasy, everything fantasy, and psychiatry. So I'm combining my two passions here by making psychoeducational fan fiction to teach people about autism, for example. I am an openly autistic and ADHD psychiatrist, and I'm joined by my actual real life husband, playing my fan fiction husband, Ronald Weasley. He has a master's in public health, and he also does the character voices, like for the voice of Smaug the dragon or Smeagol in my Lord of the Rings OCD presentation, etc. He's amazing. Um, and I'm also joined by Dr. Jessica Hogan. She does awesome neurodiversity affirming autism assessments in Minnesota and California. She's playing head of Ravenclaw House, Rowena Ravenclaw. And she is openly autistic, as well as Charnel Widnall, who is an autistic therapist focusing on helping people with autism. And she's a particularly good friend because she actually watched the Harry Potter movies for the very first time just so she could do this presentation for me and help embody the role of Luna Lovegood. We appreciate you. So, unfortunately, before we get into character, we must address that J.K. Rowling has made anti-trans comments that are hurtful to many of us, and a PowerPoint slide cannot adequately summarize that pain. And because of this, I considered not making this presentation. However, Emma Watson, Daniel Radcliffe, and other in the Harry Potter franchise have been vocal supporters of trans rights. And I believe the character of Hermione represents social justice for all and embodies the values of neurodiversity. So I'm not letting J.K. Rowling or the Florida Department of Health, where I live, stop me from doing this presentation. Now we will introduce ourselves. Hi, I'm Hermione. I have so much to tell you about autism. I didn't know I was autistic until our little daughter Rosie got evaluated, and everything I was reading about as I learned about autism fit so well. It was like someone had been spying on my life. So I started writing about it, and all the mysteries of my childhood were finally falling into place. I want to update the world on autism.
Hello, I'm Rowena Ravenclaw, founder of Ravenclaw House of Hogwarts, and while I am deceased, it hasn't stopped me from advocating for autistic minds. Wit beyond measure is mind's greatest treasure.
And I'm Luna Lovegood.
Oh, Ron Weasley. I honestly don't know why I'm here. Because Hermione asked me to come.
You're here, Ron, as my supportive neurotypical partner to help me advocate for a better world for our daughter Rosie.
Right, I am.
Anyways, as we all know, autism is a different brain type, and there are three main categories of difference: different ways of processing language and communicating, different ways of connecting with others and socializing, and a different sensory perception of the world, and potentially intense special interests.
The neurodiversity paradigm believes that all neurotypes belong and have value in humanity. The goal of neurodiversity affirming treatment is for an autistic individual to understand their needs, strengths, and vulnerabilities and live their most fulfilled and functional life.
The more traditional medical model of care believed that the most common neurotype is the normal and right way to be, and the goal of treatment was to cure someone or make them seem as neurotypical as possible.
Oh, I don't want Hermione to be normal.
The DSM-5 medical model and deficit-based criteria for autism include abnormal social approach and failure of back-and-forth conversation, deficits in nonverbal communication, and deficits in developing, maintaining, and understanding relationships.
can be reframed into neurodiversity affirming criteria, such as tendency to talk passionately about certain topics and not want to engage in small talk, differences in nonverbal communication, including stimming while talking or looking elsewhere. And due to these differences in communication, sometimes autistics may be shunned by neurotypicals.
Deficit-based DSM-5 criteria include insistence on sameness, inflexible adherence to routines, and highly restricted, fixated interests that are abnormal in intensity or focus.
A neurodiversity approach, this can be reframed as security and comfort in routines, which decreases our sensory overwhelm as autistics are experiencing the sensory environment differently than neurotypicals. And autistics feel very passionately about our special interests, so we use them for emotion regulation and rejuvenation. A neurodiversity affirmative approach doesn't mean avoiding treatment or medication, nor does it mean we ignore or minimize the pain and suffering of autistic people. It means we recognize that being different is okay and healthy and have a balanced view of both our vulnerabilities and our strengths.
For example, common autistic strengths include pattern recognition, being less influenced by social norms, honesty, detailed perception, and processing, just to name a few.
Back in my day, when I was still alive and not a ghost yet, people believed many dark myths about autism, some of which are still common among muggles today. For example, they used to believe that cold, so-called refrigerator mothers caused autism, that autistic people don't feel emotions, or that they don't care about people. Ugh.
May curiosity and openness to new information be your Patronus charm against these dark myths.
80% of autistic women remain undiagnosed at age 18.
Our original diagnostic criteria are based on a subset of autistic males, while girls and those raised as girls tend to compensate and mask their autistic traits, internalize their distress, and cause less disruption than the boys. The masking of autistic traits is associated with lower self-esteem, chronic fatigue, loneliness, and even suicidal thoughts. These girls don't cause as much problems for their teachers, even though they are suffering inside and their autism isn't seen. Personally, I was quite late diagnosed, posthumously, in fact.
A common muggle myth is that women and girls have less severe autism, so they are impacted less.
Honestly, don't they read? A 2020 study sampled 486 autistic adults and found higher levels of additional psychiatric diagnoses in autistic women and non-binary autistic people. 31% of autistic women compared to 18% of men had 2 or more psychiatric disorders. For just a bit of light reading, you can check out these Muggle studies on the psychiatric burden of late diagnosis in autistic females and those assigned female at birth.
Blimey, Hermione, you call all that light reading? Just some of the best bits for us.
Fine. Autistic girls and those assigned female at birth are more likely to make eye contact, have more social reciprocity, and compensate more effectively to present as less autistic on the surface, but experience more inner turmoil.
Yeah. Being able to hide your challenges is not the same as not having those challenges.
Girls also tend to have less atypical interests, like people are animals versus train station data. But the intensity of those interests is clearly autistic. I get this all the time. You don't look autistic.
Yeah. So how someone appears on the surface does not reveal what's happening inside.
Studies show that girls have a higher social motivation than boys, so are more likely to go up and try to initiate friendships more readily, but struggle to maintain these friendships. So there may be a pattern of intense new friendships and breakups for reasons the autistic girls can't figure out. Autistic girls also experience more relational conflict and are likely to believe that these relational conflicts are their fault.
It doesn't stop in childhood. Autistic women tend to connect less with stereotypical female roles. A very direct autistic style of communication is much more socially acceptable for men than for women, so women are more likely to be rejected and reprimanded in the workplace.
My father-in-law, Newt Scamander, can go around the Academy of Magical Zoology as autistic as he likes without any reprimand. And I do the exact same thing, and I get called into human resource meetings. No one would ever call him things like loony Lovegood.
Research studies based their criteria on white males, so genderqueer, girls, and autistic people of color are more likely to be missed.
As Dumbledore says, happiness can be found even in the darkest of times, if only one remembers to turn on the light of self-knowledge through accurate diagnosis.
Black autistic children are 2.6 times more likely to be misdiagnosed than white autistic children, most commonly with diagnoses of things like adjustment disorder, conduct disorder, or ODD.
Nothing has given me as much freedom, self-understanding, and self-compassion as finally getting an accurate diagnosis.
Yeah, never underestimate the power of an accurate diagnosis, nor the harm of an inaccurate label.
For example, autistic women are much more likely to be misdiagnosed by muggle doctors as borderline personality disorder.
You know how the sorting hat neatly sorted us into different houses? Don't suppose they have something like that to point out who's autistic?
Honestly, Ronald, we don't have a hat to show who's autistic. We do, however, have newer validated assessments, such as the RAADSR, which is a self-assessment that clients can access for free online at Embrace Autism website, and the clinician-administered MIG-DOS 2, and they have much better psychometric validity than the sorting hat.
I always mistrusted that smelly old hat anyway. What about self-diagnosis?
Many witches and wizards can benefit from an autistic understanding of themselves without risking the pain of another misdiagnosis by pursuing a formal assessment. Devin Price's article offers a good summary of other reasons witches and wizards might prefer self-diagnosis.
In the Psychiatry and Psychotherapy podcast, Dr. David Puder says, let the patient be the expert on their lives and you be the student. Of course, sometimes people misdiagnose themselves, just like doctors misdiagnose people. All of us have biases that get in the way of seeing ourselves clearly, but patients are still the best sources of information about themselves. Muggle therapists should really at least strongly consider a client's self-diagnosis of autism before dismissing it. Client and therapist are like expert co-investigators exploring a new diagnosis together.
And autistic people are good at doing a deep dive into information that interests them, so they can learn and investigate whether this fits them.
And no rating assessment will ever be as accurate as a detailed clinical interview that emphasizes the client's inner experiences.
Blimey, that's a lot more complicated than the sorting hat system.
Well, you still haven't read Is This Autism? A Guide for Clinicians and Everyone Else by Donna Henderson et al. And the companion guide for diagnosis or the Adult Autism Assessment Handbook, a neurodiversity affirmative approach.
What's a neurodiversity affirmative approach?
Well, the more traditional medical model of care presumes that there is a normal way of being, and anything significantly different from this normal way needs to be fixed. Neurodiversity affirming treatment understands that diverse brain types are desirable and offer a benefit to society. The goal is to help the autistic person be their most authentic and functional self.
Yes. Neurodiversity affirming doesn't mean we only focus on our strengths. We can celebrate autistic strengths without minimizing or sanitizing the real pain and also dysfunction that autistic people experience from living in a world not designed for us.
How do these medical blokes get updated to give neurodiversity affirming care to autistic folks?
Oh, I know that. I can answer that question. Increasing my awareness of the unique way house elves perceive the world when I created Spew enabled me to be more helpful when advocating for them. This inspired my next project to improve healthcare and mental health treatment for autistic people through autistic cultural knowledge. For short. I'm going to teach people about autism, challenge harmful myths and stereotypes, and
I should have seen that coming. First it was Spew, now it's Ock. Brilliant.
Ron, let's start with one of the most harmful muggle myths about autism, that autistic people lack empathy or have no theory of mind.
At the same time that researchers were representing autistic people as lacking theory of mind, society was defining this theory of mind as what makes us human, essentially robbing autistic people of their perceived humanity.
That's rubbish.
Many autistic people are actually hyper aware of the emotions of others, experiencing them more intensely, and have a strong sense of social justice and care for all life forms.
So how did this muggle myth about autistic people lacking empathy come about?
Must be the Raxperts. You know, invisible creatures that float in people's ears and make their brain go all fuzzy.
Actually, I'll explain emotions and empathy a little bit. So, say your emotions are the different flavors of Bertie Bott's Every Flavor Beats. And some people are great at picking out the strawberry, the watermelon, the earwax. And for some people, it's like their different emotions, all jelly beans, got put in one of those muggle microwave machines and all melted together. Kind of like color blindness, but for distinguishing one's inner feeling states. Muggle doctors call this alexithymia.
Society's traditional perception of autism was based on a subset of autistic people with significant alexithymia. This doesn't represent all autistic people because many autistics, especially women, experience hyperempathy.
The ability, and furthermore, for autistic people with alexithymia, the issue is not a lack of empathy for other people, but instead difficulty perceiving and differentiating between their emotions and perceiving and differentiating between other people's emotions. The ability to perceive detailed emotions occurs on a spectrum and is a skill that can be cultivated. I really like Dr. Megan Neff's resources on neurodivergentinsights.com for alexithymia.
Compassionate empathy is different. It's feeling for someone, concern for someone, a desire to help. This can be heightened in autistic people.
We tend to greatly value fairness and equality, treating others the same, irrespective of social hierarchy. We may have an unusually strong moral compass.
Remember when you tried to save all the house elves and left those hideous knitted hats and socks all over the Gryffindor Commons room to free them? I kept telling you the house elves didn't want to be freed.
The house elves were slaves. They just didn't know it. They were basically brainwashed by house elf culture to be okay with it. Autistic people are often the whistleblowers who point out injustices in system. It does come at a cost. I can't help but speak out. It's in my very nature. This leads us to cognitive empathy. So, when I was trying to save the house elves, it was hard for me to understand that from the house elves' perspective and worldview, I needed to go slower to get them to come around.
Mm. Neurotypicals can be quite attached to their social structures and hierarchies.
Indeed.
Traditionally, scientists thought autistic people struggled with cognitive empathy, also called perspective taking. But more recent research shows that while autistic people may struggle to understand the perspective of neurotypicals, autistic people are better than non-autistic people at understanding other autistic people. So is it really a problem of cognitive empathy? Or just that perspective taking across neurotypes is tricky, like a cultural difference?
Autistic culture is based less on subtext or social determinants of behavior. It prioritizes expediency and facts.
The neurotypical way is to say it gently and subtly so people don't think you're disrespectful.
The autistic way is to be direct and clear.
Protecting relationships within a social hierarchy is important.
Communicating accurate information is the priority.
What is socially acceptable?
What is logical and most efficient? Autistic people also, and ADHDers, tend to express empathy differently. We share personal stories to show the other person that we understand them because we've experienced something similar. Like this one time, Ginny was talking to me about how sad she was that Harry Potter didn't know who she was. She was really hurt. And I was telling her how hurt I was because Ron was going all over the place snogging Lavender Brown. And she said I was trying to make it all about myself. But really, I was trying to show her that I understood her.
I mean, why did it take Harry so long to realize he liked Ginny and finally make a move?
What an idiot. People accused me of not caring what other people think. I actually care quite a lot. Not being able to figure out the right expected response to someone's feelings is different than not caring about them. Thank you, Rob.
Rejection sensitivity dysphoria is an overwhelming and intense pain of rejection and shame experienced by ADHDers and autistics. It can certainly feel worse than death. Some suggest it involves a trauma response built up by repeated past experiences of rejection.
For the longest time, I couldn't figure out what was wrong with me. People always misunderstood me and kept calling me annoying, and I had no idea why. I just assumed I was a weird person and I was just always too much for everyone. I always seemed to make the wrong first impression.
She told me there was dirt on my nose. I thought, who does she think she is, me mum?
I thought you would want to know. People kept getting mad at me all the time and no one would explain. Remember that one time in Professor Flitwick's office? I was thinking, ooh, years of speech therapy have finally paid off. This cute red-haired boy is going to notice me when I help him out with his pronunciation.
It's Leviosa, not Leviosa. I thought she was trying to show me up.
Also, I love teaching people. And I love when other people teach me something new. But not everyone appreciates a bit of new knowledge.
Autistic people connect by sharing information that is of interest to them. We affectionately call this info dumping.
Snape called it being an insufferable know-it-all.
Then I finally discovered that I'm autistic. And some of my friends were like, oh, I'm sorry. Don't worry, you're so high functioning. Bollocks. For me, it was awesome. I'm not a weird, annoying know-it-all. I'm an autistic ADHDer. My brain works differently. And I'm not alone. Wait, where's my wand?
Did you lose your wand again, my love?
Have you seen my wand, Ron? Oh, thank you. Aloha Mora brain.
That's the unlocking spell.
The things I used to feel ashamed of, I now know they're just part of my neurotype. My autism diagnosis helped me to be more understanding of myself and create a new operating manual for my brain, like knowing I'm a Muggle Apple computer instead of a Muggle PC. I'm more aware of my emotions. I'm better at taking care of myself, and I like myself much more. After my diagnosis, I was worried that Ron might feel shortchanged, like he married a defective wife.
Look at that. Being autistic, I think, is a big part of why I'm in love with you. You are just you. You're not influenced by what society tells you women should be or want or do. You're never afraid to do exactly what you think is right. Social norms be damned. It's a lot, but I'm never bored. And your brain basically saved the world. How does your brain do that?
Internalized ableism is when autistic people see their traits or their flaws only as deficits that need to be fixed. Hold those who accept you as you are close to your heart, Hermione.
Yeah, being different isn't a bad thing. It means you're brave enough to be yourself.
Ron and I did have a major row over whether or not to have our daughter Rosie diagnosed and when and how we should tell her. I explained to Ron that I wish I knew much earlier in life. And now that I know, I'm much more forgiving of myself.
Looking back, I was really scared. What if she uses it as an excuse and becomes even more autistic? I didn't know how important it was for her to know herself and let her be herself. And I was afraid what the world would think about her when they knew. I just wanted to protect her from all that. And I was worried I couldn't be the best dad for Rosie. There's some ways you understand our little Rosie, Hermione, that I can't ever really understand because we don't have the same neurotype. You know, I envy that I envy that some, and I had to make peace with that.
No one can replace you as little Rosie's father, Ron, no matter your neurotype.
My dad had a hard time too when I told him about my diagnosis. He said it must be a Nargle conspiracy or because of Muggle TikTok. I think he was afraid because he knew that we were so alike that me being autistic meant he would have to face that he was autistic too.
Yeah. Many parents are diagnosed after the diagnosis of their children. Finally realizing I'm autistic and ADHD helped me to start to let go of some of the horrible labels I gave myself as a child: rude, selfish, overly sensitive, weird, too intense, difficult,
We make sure our Rosie has different labels to understand herself.
perceptive,
Open,
Passionate,
Unique,
independent,
and expert.
brave,
accepting,
honest,
Analytical.
logical.
creative.
outspoken.
Like I told our Rosie, thank God you inherited your mother's brain.
Anyway, here's some ways that autistic minds are different, not less than. Neurotypicals tend to start with top-down general assumptions, which enables faster processing and response time, while autistics tend to process details first and create a whole picture, which causes slower processing but allows for greater accuracy. Also, autistics tend to be less susceptible to preconceived notions. They tend to be creative problem solvers, reason in a more logically consistent manner, and they are good at pattern recognition.
We have a monotropic attention style. When something captures our interest, we get sucked in deep into a flow state and are very passionate.
Some would say obsessive.
intense about our special interests. My special interests aren't just something I enjoy, they're something I need. Autistic people use engagement in their special interests to emotionally regulate themselves. Transitioning out of a flow state while exploring my special interests can be very hard. Like, my brain is a mandrake root with its roots burrowing deep comfortably into my pot, into the soil of my special interests. And I'm suddenly ripped out of my pot, and it's physically painful.
Sometimes you sound like that mandrake root too.
We call that a meltdown.
Differences in interoception can trigger meltdowns. This is a fancy muggle doctor term for challenges in perceiving your body's signals like hunger, thirst, fatigue, muscle tension, so on and so forth. Muggle occupational therapist Kelly Mahler has great resources on cultivating better interoceptive perception.
So it's like a neurotypical brain has this thermometer where it realizes, oh, I'm getting a little hungry. I better get a snack. And I don't realize it. I'm reading and I'm reading and I'm reading. Uh-oh. And I'm raging and hangry.
You're a little scary sometimes, you know that? Brilliant, but scary. It would have helped our relationship a lot if I understood years ago, but I know now if I want to have a serious talk, I make sure she ate first.
My sensory system doesn't acclimate to or tune out intrusive sensory experiences, like a clock ticking or a tag in my clothing. My brain takes in all the sensory details while I have to analyze other people's behavior to figure out the expected response and what I'm supposed to do.
One person's brain couldn't do all that at the same time. They'd explode.
Just because your neurotypical brain analyzes a gestalt of what's going on.
The autistic mind isn't overwhelmed more easily. It is processing so much more information simultaneously with a different sensory perception of the world.
So, after realizing that I'm autistic, I still have meltdowns, but I have an explanation for why I'm having a meltdown and why I'm so overwhelmed. So it helps me circumvent the self-shaming cycle, and I can emotionally regulate faster and help prevent meltdowns.
Don't worry, Hermione. You're just as sane as I am.
Meltdowns are different than panic attacks. Panic attacks may not have a clear trigger and usually come and go quickly, within 30 minutes. Meltdowns may build up over time, usually due to sensory and emotional overload.
Learning my unique sensory needs was key to soothing my nervous system. Some sensory inputs I need more of, and I find them really soothing, like soft, fluffy things. And other things I'm really sensitive to. I'm hypersensitive to loud sound and bright lights. So if we're going to Hogsmeade for some shopping, I bring earplugs and I wear sunglasses.
Yeah, and I like to spin in circles and eat really spicy foods, but bright lights bother me. So I wear special sunglasses too.
Exposure therapy doesn't make the sensitivity less. I can't just get used to it over time.
When an autistic person keeps pushing themselves beyond their body's signals to stop, through the demands of socialization and masking, they can become burnt out. Autistic burnout includes intense fatigue, loss of skills, and reduced sensory tolerance. This can look like depression, but unlike depression, where you might encourage the person to get out and socialize, someone in autistic burnout needs to physically rest, unmask, soothe their sensory system, decrease demands, and maybe engage in special interests.
I use a time turner to get more things done, and I take on too much sometimes.
Sometimes. All the time.
Rather frequently, perhaps. I take on too much, and I'm not sad or despondent. I'm just physically completely exhausted and used up, like I want to hibernate under a pile of books. I need to spend time unmasking with low social demands to recover.
How does masking and unmasking work?
Masking is just cosplaying as a neurotypical.
Masking is when an autistic person suppresses their autistic traits, closely watches neurotypicals so they can mimic their facial expressions and body language, and perhaps try to be excessively helpful and accommodating to avoid rejection.
And another one of my favorite books, Unmasking Autism, Discovering the New Faces of Neurodiversity by Devin Price, one of my favorite trans autistic authors. They are quoted as saying, "We have to keep other people at arm's length because letting them see our hyperfixations, meltdowns, obsessions, and outbursts could mean losing their respect. But locking ourselves away means we can't ever be fully loved."
My mask is my shield, but sometimes shields can be suffocating.
It's not just about being uncomfortable when masking. I'm spending so much cognitive and emotional energy performing for people while suppressing the things that soothe and energize me, like stimming, that I have very little energy left for magic.
Yeah. I've heard muggles describe it as like a muggle cell phone living on low power mode.
What's stimming?
Honestly, don't you read? Stimming is repetitive self-soothing behaviors that people do to regulate their nervous system.
So I like spinning and humming.
I like rubbing fluffy things between my fingers. Sometimes I make noises.
Those weird little noises you make are cute.
Deciding whether or not to mask is a cost-benefit analysis.
Mm. To mask or not to mask?
To mask. Safety, job security, less risk of rejection, society being more willing to listen to us.
Not to mask. Freedom, lower risk of suicide, anxiety, and depression. More energy and creativity to do what we love. Authentic relationships.
And when autistics unmask, society gains novel insights and perspectives and must grapple with change and growth.
When autistics mask, neurotypicals feel more comfortable and social systems are more stable.
It's not just about us autistic people. What does society lose when autistic people are fully masked?
We all develop ways to hide our authentic selves to survive a world that doesn't understand or accept us.
Autistic people protect themselves by hiding their autistic traits and learning to perform as neurotypical, focusing on pleasing others.
Experiences with therapists, teachers, or parents who in the past viewed our autistic way of being as needing to be fixed intensifies this self-protective strategy of hiding our true selves. Many autistic people internalize the sense that their autistic way of being is broken.
Autistic clients may be more eager to please their therapist as an old survival mechanism and truly struggle to express their authentic selves.
Or even know who their authentic selves are.
Okay, so therapist blokes really need to not try to fix the autism.
Yes, Ron.
Yes, Ron, therapists can instead help the autistic person live authentically and effectively and recognize when they are masking so they can mask and unmask more intentionally.
My therapist helped me understand situations in my adult life in which it was safer to be my authentic self and with whom I could be safe. She gave me podcasts and videos of other autistic people enjoying their authentic autistic selves. I thought back to the activities and interests I found most enjoyable and soothing and renewing in my childhood. to bring those activities back into my current adult life. Now I have the freedom to choose when masking works for me, such as a certain Ministry of Magic meeting, and when I can express myself.
What else can therapists do to modify their treatment approach for autistic folks?
Curiosity and openness are key to following your autistic client's lead. They have powerful insider knowledge about themselves. For example, what is most regulating or dysregulating for their autistic nervous systems? This is true for all neurotypes, but keep in mind that neurotypical blinders can lead to inaccurate assumptions. What works for autistics may be different from what works for other clients.
So, providing a safe space for an autistic person to show up as their fully autistic self by encouraging stimming, info dumping about their special interest in session is powerfully healing.
And autistic people tend to need more explanations and information. Please don't take offense to that.
They may need to provide a greater detail of context in session, need more time to process their answers to questions, and need you to ask more concrete questions.
Bottom up strategies and allowing different language choice for describing emotions. For example, you might need to start with behavioral descriptions, such as wanting to hit Ron with a book emotion, or wanting to curl up in bed and hide emotion, and build emotional perception and vocabulary prior to expecting autistics to answer vague questions like, how are you feeling?
Be flexible to modify your approach based on the unique brain type of your client. For example, if someone has aphantasia and can't create visual imagery, it might be difficult to do a visualization exercise, and we may need to use a different approach. Be open and listen when clients say, I don't know, when you ask them about their feelings, and allow time for processing.
And remember that non speaking does not mean that they aren't communicating. Honor multiple forms of communication.
Explore the function of a behavior before trying to treat it. For example, organizing Pokemon cards repeatedly could be an OCD symptom to do exposure and response prevention with, or it could be a self regulating stim and engagement in their special interests to be encouraged.
So, for example, not all defiance is the same. PDA, or pathological demand avoidance, or otherwise known as pervasive drive for autonomy, is a profile of autism that may be misdiagnosed as ODD. PDAers experience an intense trauma response to the perceived loss of autonomy and is beyond the scope of this presentation. But here are some resources to do a deep dive on this topic.
Both mental health professionals and medical professionals can become more aware of the unique health issues autistic people face, which lower autistic life expectancy. Autistic people have higher rates of autoimmune disorders, hypermobility disorders, chronic pain, celiac disease, fibromyalgia, and dysautonomia, just to name a few.
I told my doctor my symptoms, and they always called me loony. Not only do autistic people experience more chronic health conditions, but we also are more likely to avoid healthcare treatment because our doctors don't believe us.
The triple empathy problem.
What's the triple empathy problem?
It's a reference to Milton's double empathy problem, which refers to the difficulty with communication and perspective taking between autistics and neurotypicals.
The triple empathy problem refers to how there is a miscommunication and failure of understanding due to differences in perspective between doctors and patients. So for autistic people, there's an extra layer of miscommunication and misunderstanding between neurotypical doctors and autistic patients. It's honestly hard to keep at it when you're so used to getting a negative response from your doctors. I really do try to be an exceptional patient. I made a binder of my medical history for all my appointments, which included a spreadsheet of my symptoms to help my doctor. I offered a few,
A dozen more likes.
perhaps more than a few, very helpful New England Journal of Medicine meta-analyses regarding my top 3 hypotheses.
I told you, Hermione, not to bring all the medical journal articles, because those medical blokes don't want all that data. You came on too strong.
Too strong. I want to get help to feel better. I don't know how to talk to these muggle doctors. Apparently, presenting too much evidence makes the doctor not believe you. Rubbish.
Do you tell your doctor that you're autistic?
It's really valuable information for a primary care doctor, for example, to know because of all the health issues that co-occur with autism.
Yeah, but then you get like, no, you're not autistic.
Or they infantilize you or patronize you.
And don't take you seriously.
It's so hard knowing who is safe to disclose your diagnosis to.
Muggle doctor Mel Hauser's website, All Brains Belong, has a lot of information about the autistic nervous system and great written material for autistic people to learn about all these common co-occurring health conditions to give to their doctors.
I downloaded the Autistic ADHD Health Guide on Dr. Melhouse's website for Hermione.
Having Ron here helps me so much with the medical visits.
Aspire website has some great worksheets that therapists can help their clients fill out to prepare for healthcare visits. And finding a doctor who understands autism is really hard.
For ethnic and gender minority autistics, the challenges of finding a therapist or doctor are even greater.
Newt used to talk about how hard it was to choose between someone who understood their gender and someone who understood their neurotype.
We hope to educate more health professionals about autism to mitigate the impact of intersectional marginalization.
In fact, the majority of autistics are not cisgender and are not heterosexual. Transgender autistics are more likely to have others not believe their gender identity because of their autism.
And autistic people are just as capable of defining their own gender as neurotypicals.
Another myth is that autistic people don't desire romance or sex or don't feel as much love in relationships.
Well, I can tell you that's bollocks.
While being asexual or aromantic is more common in the autistic population than in the neurotypical population, most autistic people are still sexual and romantic, and the feelings we experience towards our loved ones are just as powerful, sometimes more intense, than neurotypicals.
Really, there's a muggle myth that autistic people don't have sex. Where do the autistic babies all come from?
Here are some great resources for ongoing self-directed learning about neuroqueer identities. Finding a neurodiversity affirming mental health professional is important.
Again, neurodiversity affirming care recognizes both the strengths and challenges of an individual's neurotype. Neurodiversity affirming professionals center the needs and well-being of their autistic clients rather than trying to make them appear more neurotypical. They help people build a positive autistic identity, connect with other autistic people, and take pride in autistic culture. They have a balanced view, neither claiming that autism is a superpower, nor calling it a disorder that needs to be fixed. Use sites such as ndtherapist.com and neurodivergentpractitioners.com for therapists and assessors. Neuroclastic.com has a directory of assessors that are more likely to be affirming.
Fear of a name only increases fear of the thing itself. So can we stop saying a little on the spectrum and just say the word autistic? The attitudes of doctors, therapists, and family members matter. We need to model for children how to respond to a new diagnosis by not hiding it from them.
Here are some great neurodiversity affirming podcasts where you can listen to thriving autistic role models.
It was so healing to connect with other autistic witches and wizards, to know that I wasn't alone with my struggles, and to see my experience of the world modeled in other people's experiences. I also found videos and articles to help Ron and Harry understand me and little Rosie better too. And here are just a few of some of my favorite books for a deeper understanding of diagnosing autism. There's Donna Henderson's book, Is This Autism? A Guide for Clinicians and Everyone Else.
Divergent Mind and We're Not Broken are great for families and clients.
I recommend Beyond Behaviors for parents needing strategies to support their autistic children.
And Unmasking Autism by Devin Price is a neurodiversity affirming classic.
The Neurodivergent Friendly DBT workbook offers great tables to modify your sensory environment and design appropriate accommodations for yourself.
You're going to read them all and summarize them for me, right?
In conclusion, we dedicate this presentation to all the unseen autistics and hope more clinicians will be inspired to learn about and recognize autism. If you believe that you are not someone who treats autistic people, you are actually treating them. You just don't know who they are yet. So please do your best to educate yourself and learn, especially from other autistic people, especially those who have special interests in teaching other people about autism, perhaps. Thank you so much for joining us. Stay curious. We are now going to take questions. I will stop sharing my screen. There's a question. Matt.
Yeah, so actually I had an interesting situation had come up a couple of weeks ago where I got preteen, I'm not going to give exact ages for privacy reasons.
Okay.
Who I would, define as moderately autistic for all intents and purposes. Normally I feel like I can usually handle, most autistic clients pretty well, but for him, I realized, just like with his symptomology plus his grief, and again, those two I can use kind of, I don't really specialize in autism myself, but I can usually handle how the autism related behaviors. I'm going to call them behaviors versus symptoms.
Okay, it's fine.
But for him, I was just like, you know what? I'm realizing that I'm not the right fit as a therapist. Because
we got no limitations.
Because the autism behaviors were just too much for me for my skills as a therapist at that point.
Okay.
Any thoughts about how I can, things I should keep in mind when I'm treating, clients with autism, and especially on the kind of younger, normally my age range is like 10 and up is kind of my preferred age range, and he was on that on the lower end of that age range, let's call it that.
Yeah, that's a good question. Do you want to go first, Charnel, or Jess, or
I guess I clarify what the question was. Just any ideas about how to respond when you're working with a client whose ways of being are either triggering for you or their goals for therapy are outside the scope of your practice?
So,
or are you looking for other people to refer to maybe when you're in that situation? Yeah,
so for this client, where I normally engage in play therapy, like Uno, or even basic card games, this client just was not able to engage with Uno effectively, he despite the family trying to do teach him numerous times before, I felt like my skill set at this point is just I'm like, okay, I don't quite know how to help you at this point, and given that he presents more, again, kind of separating the physical age versus the developmental age. He presents developmentally lower than my
Yeah.
than what I typically normally see.
So I mean, I think you would want to refer them to someone who specializes in more in autistic people and also with younger ages. And we showed the websites earlier. I can share my screen again and pull them up. And in the meantime, I've thought, Jess or Charnel, how like we connect people to those people.
Yeah, so I would check out the ND therapist site, and I would
There it is.
Yeah, I would look at your state, and then you'll be able to see like other people who are neurodivergent themselves that work with kids.
Yeah, thankfully I was able to transfer them to our own intern who apparently has a child who has autism themselves, but so she's more equipped, but still just like, okay, I was like, I'm clearly outside my depth here, with these
Recognizing
two
that's
presenters.
important. Mm-hmm.
So
Be right back. My air conditioning is really hot. Keep going though.
Yeah, I think there's just two parts: recognizing that it wasn't a good match in counseling, perhaps for whatever reason, or outside your scope of practice, and then understanding how to find the right person for that client. And yeah, I don't know if you have access to the slides, but those websites might be some good starting. But as you said, you already knew somebody, so you used your networking.
Yeah, and again, I'm on our neurodivergent, counseling Facebook page for Massachusetts. So, I know if I was really struggling, my supervisor allowed it, I would kind of post there too. But thankfully our intern has much more experience than I do working with this kiddo with the kiddo more of this age than I do.
I just want to say another thing that sometimes can be confusing when a parent brings a child in is like, what are the goals of the therapy? And just clarifying that sometimes the goals of the therapy are coming from the parent, and it's not really you're not really understanding how to make sense of that in aligning with the client.
Yeah, and not to give too many details, but this kid lost both his parents and was hyper focused. Well, not both his parents, but his primary caregiver, and he had to move suddenly to a new city. So it was primarily the grief. But for me to even like work on the grief, to even start building rapport with him to go there, it would have been kind of navigating kind of the autism, the autistic behaviors to even just get past that, to get to that hurdle of like, okay, let's, and again, I will own that was something that I wasn't equipped with.
Yeah, sounds like you did the right thing. Other questions? All questions are good. Find your inner Hermione and ask some questions, guys.
I have a question for Rowena. You mentioned that you were diagnosed posthumously. I'm curious about what that process was like, and how involved you were. If it was like other people that diagnosed you, or if you were present and actually had an evaluation. And then related to that, like, what can you talk about the diagnosis process, and what would you say to people who have self-diagnosed, because they see a lot on social media, maybe they've read a book or two, and then how to take that next step?
Yeah, definitely. And I did go in for a formal autism assessment with another autistic ghost for my assessment, and I kind of self-identified with more so the ADHD. But if someone was looking for an autism assessment with an affirming assessor, it might look a lot different than kind of classically like what you might think of as like an autism evaluation. So in an affirming evaluation, instead of relying on what the assessor can observe about you, like if you're making eye contact, or if you're stimming, or if you're able to throw the ball back when they throw the ball to you for a conversation. Instead of relying on those kinds of observations, we really get at like the lived experience of the person. So we ask someone, what's your experience of eye contact? What's your experience of masking? What are social relationships like for you? And are these maybe different than what neurotypical relationships might look like? And really focusing on that. So while we might involve somebody from your life, an observer, that's definitely not required for a diagnosis, especially since the DSM allows for, like if there is information from the developmental period that might be missing for whatever reason, like if the person's adopted or the parent's unavailable, that doesn't necessarily mean that they can't get a diagnosis, which is a big like myth that a lot of assessors don't know or aren't familiar with. So yeah, it's a big interview process, lots of interviewing, going into lived experiences. And then there's also usually a personality test involved and some other measures as well.
Good question. I had my husband join me for my psychological assessment, and because I was, and it's funny, right? Because I'm a psychiatrist. I do diagnose autism on a regular basis, but I wanted a formal assessment too and have that other perspective. And I asked Josh if he felt that I was representing myself accurately and it fit, etc. And still, it took me some time. I'm like, am I really autistic? Really? And I think I also found it so helpful for me in my ability to recognize and diagnose my autistic patients, and understanding the lens through which I view my patients, my autistic versus my neurotypical patients. Yeah. Did you want to add anything, Charnel, or should we go to another question? No? Cool.
Yeah.
All right. Good question. Other questions, people?
I have a question. It's Trevor.
Yes.
I am autistic and I am starting a new job Monday.
Cool.
I haven't worked with other people in quite a while. I've been self-employed. I had my own practice, so I'm going into clinical community mental health. Any tips on someone who is not? I don't tell people usually. I mean, I haven't had but a few people that have asked me, but I normally don't tell people. And like I said, I haven't been in a work environment since I found out. So since I got diagnosed, this is going to be my first time in a work environment. I am a therapist and I will be working with other therapists. Any tips on kind of how to navigate a job like that for someone who hasn't done that in a while after diagnosis? Like pre-diagnosis, I didn't know why I was having problems. And I'm assuming post-diagnosis now I kind of know. I kind of recognized why I had problems in the past. But this is that it's a little nerve-wracking because it's also a therapist who can, many of which are probably able to see that I am different. But it just depends. So I don't know if you guys have any anything.
I'm putting this in the chat. This is an article from Neurodivergent Insights on self-disclosure, and they're actually worksheets, and it's about the complex decision of I could do a screen share and even show this 1 second of self-disclosure. So it depends on other people when you explain that you're autistic, what autism is. See here, and it's also, you can be as simple as, she shows it on her thermometer here. I have sensory sensitivities, small disclosures. Sometimes I misread social cues, all the way to I am autistic. And so it's not a black and white, yes or no, do you disclose type of decision. I will say that I'm very privileged as a psychiatrist in private practice, and love teaching people about autism. So I don't mind when my office staff ask me a question. You also, if you're going to self-disclose, you might get a lot of questions about autism and need to be ready for that. I find it really helpful to explain to my office staff that I'm going to miss things if they don't say it very directly, or if I'm not focused on them at the time. And talking about my strengths and vulnerabilities really helps us have a culture of greater openness that I think the neurotypicals in the office benefit from too, because of the direct communication that takes place. That being said, I'm my own boss, so I can't fire myself. I mean, I could fire myself, but and so you don't know. It can be there. Studies do show that when autistic people are able to self-disclose, generally, they experience less depression, less anxiety, and that can also be beneficial from a mental health perspective for autistic therapists and psychiatrists to disclose to their clients and patients. However, discrimination is very real. So I would say, read through the Neurodivergent Insights website and kind of go through your decision tree and test the waters with some of the more smaller disclosures like sensory sensitivities, see how people respond, and be very specific, to at least be specific with people on how you communicate and how they can communicate with you best. So I'll be like, hey, if you think that I didn't care about something you said to me, think again. I do care about what you're trying to communicate with me. I just may not have understood it. And kind of coaching people in that way preemptively to help prevent miscommunications works well, whether you disclose or not. What are your guys' thoughts?
Yeah, I loved that, Stacey. Just a couple like thoughts to add. While you're kind of like assessing whether the environment is going to be like safe to like disclose and like informally or formally ask like for others to accommodate you, I would definitely be focusing on like, okay, like how can I like self-accommodate and really meet my needs, like myself, and how can I maybe like advocate in small ways to get those needs met. Like, for example, like taking, if it's in person, like taking lunches, like in your office maybe, and not with everybody else, or telling people like, oh, hey, actually, like I really, my brain works best like when I can have like a meeting like consistently with you, like, every week versus just scheduling it on the fly. You barging into my office and being like, let's meet now. So like the little things, whatever that need is. And yeah, you don't necessarily have to openly disclose to everybody or anybody. You can always, state the need in a way like, this is just how my brain works. This is how I work best for now, until you decide if it's safe to disclose and get actual accommodations or not. Yeah, Charnel, anything you want to add?
Yes. And another thought that was coming up was just that like really strategic planning as you begin work, that you, wherever possible, are able to give yourself as much time to rest, be alone, whatever recharge looks like for you. I'm likely you already have that set up, but just want to validate that yes, that really matters. Yeah, I hope you have some recharge time set up. Yeah, okay.
Mm-hmm.
Oh,
yeah,
and
really like
autistic and professionals as well. So I mean, there's tons of Facebook groups. Mm-hmm. We do autistic therapists Zoom like every couple weeks in our in one of the Facebook groups that we're in, which is
that's
really
how I met Jess originally.
Yep, exactly. So yeah, connecting with other neurodivergent professionals can be helpful too.
And
yeah, one of the reasons I think I'm gonna like it is it's very structured. It's community mental health, and it's very like it's very structured. I have a friend that works there that helped me get the interview. She is neurotypical, and she struggles because they are so structured, because she is used to having freedom and not having to be that structured. Like they literally every week meet at the same time for their staffing, and everything's done very structured. So that was one of the reasons I was like, well, I think I can do that because it is that structured, but it's a really small office too. So there's not going to be a whole lot of daily interaction with other employees because it is the smaller office that they have rather than the big clinic. So there are reasons I said yes, but like I said, you guys, that was great. I really excellent. What I needed. I mean, 100%.
Thanks. Yeah, got you. Other great questions just shouting out before we can keep going.
I have another question.
Yes.
And this one is regarding the format of your presentation.
Sure.
And have you done this before? And meaning, like, have you used characters, been in character to teach about autism? And if so, like, how has that been received? Like, or ideally, what groups would you teach about autism
We're
using this
open to
format?
suggestions. I would love
I'm a fan.
recommendations, please, Josue, and you can give me your thoughts on it because it's different. It's not something you see at medical conferences. Though I would love to make that happen. Jess and Josh and I got to present at MegaCon in character, and it was really fun. And we're hoping to do a Little Mermaid themed one for DragonCon. What do you suggest, Josue? I mean, I think so. Why I do it this way? It's not just because of my special interest. I'll tell you how it started. It started. I was doing a presentation on reproductive psychiatry, and I was like, okay, this needs to be case-based. So then I was looking at the internet, and I found pictures of pregnant Disney princesses. Apparently, there are a lot of pregnant Disney princess pictures on the internet, ironically. So I made Disney princess cases. Ariel was the ADHD case, and Belle had depression, and Belle and Beast went to couples therapy, etc. And then it kind of went from there. I'll share in the chat my YouTube channel, which has all of 8 subscribers so far, where you can find the videos of my other themed presentations, like the Disney Princess perinatal reproductive psychiatry one. But people, like Brene Brown says, stories are data with a soul. So it's one thing to tell people about the need to be neurodiversity affirming, and it's another thing for someone to explain what that's like in their life and what getting a diagnosis means to them. So my goal is really for people to be able to connect and for the information to have more resonance and meaning through stories. Yeah. What's Rule 34? Sorry.
It means that if there's inappropriate stuff.
Yeah.
About anything.
Say let's just say
Sorry.
that it's not safe for work. If it's just on the internet, it's not safe for work.
I think he's referring to what you said about like how there's Disney princesses in who appear pregnant. There's a version of everything on the internet. Anything that you're looking for is available.
Okay. Oh, sorry.
Sure. I think
That went
DragonCon is
over
a
my
good
head.
idea. DragonCon is a good DragonCon is a good place to go. No, I'm a fan. I mean, at Geek Therapy, we have multiple podcasts. One of them is a Disney podcast. We use it to talk about all sorts of stuff. So I'm excited to see a Little Mermaid one. And tomorrow's keynote presenter, Dr. Lawrence Rubin, he wrote a book on like a diagnosis book using fictional characters. And it's really written as a textbook. So I mean, I think this is very useful. Yeah. I mean, at Geek Therapy, right? The Geek Therapy model that we teach is using people's affinity for different characters. And then once it's like you're already open, there's already an openness that you have to that character, that world. So then being able to explain things through those characters, through the language of that franchise, it makes, I think it, it just, it
Yeah.
hits much like it's easier to swallow, and it's just, it feels better.
Yeah.
It's a safer environment.
Right.
So
I
I
mean,
like this. Yeah.
and let's face it. Okay, so I'm sitting there in a lot of people who watch my presentations are my patients and their families. Thankfully. So I'm sitting there and I'm telling them, hey, you could read this book. And then alternatively, there's this presentation where I play Hermione Granger talking about being diagnosed as autistic. And then the kid's like, you're playing Hermione Granger in this? And okay, Dr. Greeter's being weird. I think I might be interested in watching Dr. Greeter be weird and making fun of Dr. Greeter. That sounds fun, right? So I get mileage out of it that way, honestly.
You did mention fan fiction at the beginning. You've pretty
Yes.
much laid out an entire story here. Have you written it down? Thought of publishing it? Like on fan
Publishing it.
fiction sites? Yeah, because there's fan fiction sites, right, that have stories about Harry Potter characters and all sorts of
Oh, that's a
different
good idea.
alternate worlds
That's
and,
an
and
idea.
situations.
Yeah.
Yeah, I think that would be pretty cool. Yeah.
Cool.
Again,
This is
providing
what
it
I
as a
do.
different, right, as a different format as well. Somebody
Yeah.
who really likes to read, it's like, oh yeah, check out the story about the Harry Potter kids and how they discovered autism. Yeah.
Yeah.
Hmm.
That's a good fun idea. Yeah. That's the grief of having ADHD. So many great ideas, but not enough time to do them all.
But yeah.
Or energy. But yeah, I think that's cool. Jose. So what franchises would you love to see?
I don't know. I'm always very particular. Like I try to tell people, like, if you can, go for what your client really likes the most. So it depends what
Twilight.
anime I'm into now. And there you go. There's some Twilight. Yeah.
I
What would everybody
I
like
have
to
an
see?
idea for Twilight, actually. I wanted to do religious trauma and sexual dysfunction, and use the Twilight characters. Actually, maybe someday. Someone said yes. I mean, in my Disney princess cases, Snow White was my postpartum OCD and postpartum sexual dysfunction patient who had to read Come As You Are by Emily Nagoski with Prince Charming and broaden their traditional gender role views of sexuality to recover their relationship. So yeah, I have a good time. I definitely want to do I want to do space alien themed ADHD one. And that has some resonance for me personally because my ADHD was diagnosed at a young age. The ADHD was very obvious to everyone. So my teachers called me Spacey Stacy when I was in elementary school. So I would be reclaiming the Spacey Stacy moniker.
Love it.
For a outer space themed ADHD presentation is my hope. Yeah. What other thoughts do you have, people? Yeah. Oh, I have a Star Wars one. You have to check it out. Okay. So it's one of my favorites. It's called How to Become a Psychiatry Jedi: Return of the Therapeutic Alliance. And then there's a second part, The Dark Side of Psychiatry. And so the Star Wars one is about how we talk about medications with patients to really engage them in taking medication, addressing their fears, and how we connect and build that therapeutic alliance. And Josh, who is a sci-fi writer, does the amazing voice of Yoda and the amazing voice of Emperor Palpatine and of Darth Vader for my Star Wars series. And it's also about treatment-resistant patients too. So you could check that out if you like.
It's very
yeah. I'll do a screen share so you can find all of our information to check us out. Because I have our websites. I put my Star Wars series on my website. And also Josh put it on the YouTube channel that we just started. Thanks.
I see it there. Yeah. Okay. Cool.
Other
Cool,
good
cool.
questions.
Any other questions? As we get last questions, I'm putting the link for the evaluation form for those of you who want CEs. If you're not getting CEs, the eval, it's still appreciated. You can provide feedback.
Thank you.
And yeah, any other comments? I don't see any other hands up. This is really cool. This is really cool. Cosplay is always encouraged, and role play as well,
Yeah.
of course. And
Yeah.
and yeah, we're always trying to build resources at Geek Therapy for just like this. So I think
Oh, well,
your YouTube
tell me
channel.
how I can contribute some more cool stuff then, Josue.
Absolutely, absolutely. I will not forget your presentation or any of
Aw.
you.
Thank you.
It's great.
You have our emails.
Absolutely.
Yeah, it
And
was so fun
yeah.
joining you. I appreciate the opportunity.
Thank you.
Thank you so much.